Christine, thank you so much for joining me today. I'm so excited to have you on my podcast on such an important topic. And I know we spoke just briefly before we hit record about how many women are just undereducated around this topic of menopause and perimenopause and how they need to navigate it. So I want to start with what made you so passionate about this line of work, about helping women through this stage of life, and what brought you to where you are today?
Well, I'm old enough to have been practicing when the WHI hit. So I watched all of these women go from thriving, feeling amazing, to having their hormones ripped out from underneath them and thinking, God, there's got to be something better. My own mother was one of those people that she was active and healthy, and then she couldn't even hardly get out of bed because the joint pain was so bad and the hot flashes and the lack of sleep. So I said, okay, there's got to be something, and got involved. That was a long time ago, 2002, with bioidentical hormones. And honestly, in my community, I was kind of the pariah because who's doing that? We were told hormones were bad and this is all natural, God forbid. So it's come a long way since then, but that's where I really got into it.
Yeah, that's amazing. And so many symptoms that come along with perimenopause and menopause that women don't actually know or even related,
Yes.
right?
Yeah.
Most women think it's just hot flashes and they can't sleep. But you said your mom couldn't get out of bed because of joint pain.
Joint pain. And I asked a rheumatologist at the time that I worked with, and I said, why would that be? And he said, well, think about it. If you get dry in your where, I don't know if I can say that on the podcast, and you
You could
get dry,
totally say it.
he's like, wouldn't it make sense that your joint capsules get dry and creaky and achy, and the covering of your tendon sheaths and all of that? He said, everything gets dry. So just movement becomes unbearably painful. It was like, wow, that was fascinating to me because nobody really
Wow.
has that in school.
I was just going to say
Yeah.
for a specialist, like a
Yeah.
rheumatoid arthritis specialist, to, I mean, admit, I don't know if admit is the right word, but discuss that the body cannot silo symptoms to one area is incredible, first of
Yes.
all. So you had a good mentor there.
I did. Great guy. I worked with a great group of doctors. And I was doing internal medicine back in those days. So I wasn't even doing women's health, nor was it really, what I was geared towards. And yet being a woman, I had a huge female population of patients. And then watching them go down that journey and how much it was lacking is what took me into this realm.
Amazing. So let's talk about some of those, you know, maybe underlying symptoms, or let's talk about some of the things that women go through. So listeners might, maybe they haven't been told by their doctors that they are, in fact, going through this transition in life, but they are feeling some of the symptoms. They may not realize it. What are some other symptoms that women struggle with at this time?
I have seen, honestly, there's nothing that I see now that I'll say to women like, oh, that's not hormonal. Um, I see, oh, I think I'm frozen. I see a huge number of joint pain, sleep deprivation, itchy, crawly skin. I think we froze. There we are. We're back. Hi.
We're back.
I what I was saying is there's a huge number of really bizarre symptoms, and some of them I no longer negate because women will come in and say, my right shoulder hurts really badly, this, that, and the other thing. I mean, excruciatingly painful, but nothing else in my body hurts. Well, frozen shoulder now we know is an issue, right? Itchy, creepy, crawly skin, the itchy ears. We hear women talking about this one now too. So
Interesting.
yeah, there's a lot as far as, hair loss, obviously we know. I mean, the brain fog, but also the mood changes, the mood and the, depression, anxiety, and all of that. So many things. So,
Yeah, a lot of the women that I've spoken to over the years, even like confidence comes into play.
yeah. Yes.
Starting to lack confidence, not just necessarily like self-image confidence, but like walking into a meeting at work and knowing you're not going to lose your train of thought, or your sentences will actually become complete and you'll thrive in your job still. That kind of confidence. I see a lot of like anxiety, depression that come up around this time as well.
I see that particularly in perimenopause because it's so confusing to women. You're still getting your period. So you think, well, I'm not in menopause, but yet they're not sleeping. They have horrible anxiety and depression. I have a patient, she's very high up in the banking industry. She had put on 40 pounds. She was not sleeping. She had to get up and she came in to me crying. She's like, I have to get up at a podium and speak, and I'm sweating and I'm shaking and I'm forgetting my words. And you know, I have to work in this room with all these men, these very, very high powered men. This woman now, with the help of hormones, has lost her weight. Well, and other things, of course, but lost her weight and she's climbed up even higher in in that field. It's obviously it's different for women than it is for men because, we go through this.
100%. And I don't think it's talked about nearly as much as a transition when you're 13 going through puberty, right? I don't really remember much about my mom's transition other than she would freeze us out at dinner time because she was having a hot flash and she'd open the back doors at the dinner table.
Yeah.
But, like she didn't really talk about it. And I can bet, a lot of women say this is just, it's natural. So we just need to go through it.
Yeah. And that one drives me crazy because I always say, well, death is natural, but we're not ready to do that yet, are we? And a lot of things are natural, but we have now come up with ways to treat them and to put them off. And menopause, having hormones is something that was natural for us our entire lives. So when they go away, back in the old days, we died much earlier. So there really wasn't a lot of menopause to deal with. And now we're living, thank goodness, into our 80s, even 100, and it's not natural to feel horrible and have all of these other issues.
And can I just say that, and I love men, I have an amazing husband, and so I am not bashing men at all. But if we talk about menopause and perimenopause and vaginal dryness and sex drive coming down and sex being painful, and like, this is just one aspect of what, that midlife transition looks like. If you asked a man that at 45 he he like no longer ever wanted to have sex, or it was painful, or he couldn't,
Yes.
I can bet very quickly there would be a fix to this
God, yes.
and
Oh my
nobody would
God.
bat an eye.
Oh, they would be like, we have to help these poor guys. That's a terrible thing. What kills me is I have women who come in and they'll tell me that they're still having sex and it's so excruciatingly painful. And I look at them and I go, and then, they'll go, my libido's low. And I'm like, well, yeah, your brain knows that something that hurts you is not something you want to do. So, it's so sad because a guy would be like, oh, heck no, I'm not doing that. That's painful.
Exactly, and he
Yeah.
certainly wouldn't be like, "This is a natural transition," right? There would be no fix to that. So, okay, no. So let's talk about what tends to be, I guess, maybe the fix in conventional medicine. Let's talk about what that fix looks like for a lot of women. They go to their doctor, they're saying, "Oh, like my period's irregular. I'm 40 or 44, 45," or maybe they, don't have a period anymore. "Doctor, I don't feel good. Tell me what we need to do next." What is the typical fix?
I would say a lot of women are put on birth control because that'll quote unquote make their cycles regular again. So there's that quick fix that gets done. I see, I see a whole spectrum. I'll see women who are perimenopausal who have a huge amount of estrogen because you tend to be high estrogen around that time, not always, and they get a patch. And now they're bleeding like crazy and they feel worse now. They're scared of hormones. So that's the other fix I tend to see. Oh, if your hormones are off, it must just mean you need this. Instead of looking at where are you in that journey and what would be the appropriate hormone, let's maybe do some blood work, things like that. So I see a lot of confusion from providers, to be honest with you, but it's either nothing, the pill, or too much in a nutshell.
And it's always synthetic. It's always a synthetic version.
Yeah, yeah. Very, very rarely do we see a doctor now? I mean, I thank goodness we're kind of off the Prem Pro train, though there's still providers out there that prescribe it. There's still a lot that prescribe oral estrogens and synthetic progestins, but I'm seeing a trend, thank God, towards at least we're using like a 17 beta estradiol patch. Okay, thank God for that. And we're using a prometrium, a natural progesterone, instead of, the old stuff. So it's getting better, but boy, is it moving slowly. And, that only leaves you a small number of possibilities too.
Yeah. Okay. I do want to dive into the differences. Are you open to talking about
Yes,
that?
yes.
Okay. So let's talk a little bit about the oral estrogen that is synthetic, the risks or dangers of that, if there are any, versus a patch of a bioidentical form or a cream that is a progesterone. Tell me a little bit about the differences.
When you take an oral estrogen, even if I compounded it and it was a quote unquote natural, it still has to bypass your liver. And when you put estrogen through the liver, you tend to get an increase in inflammatory hormones, number one. So you see C reactive protein go up, which causes inflammation. You also see a slight increase in clotting factors. So you hear, girls on birth control pills, particularly if they smoke, have an increased risk of blood clots. Now take an older woman, and she already has a slightly increased risk and a little bit more vascular damage, and you put her on birth control, go send her on an airplane. I've seen several cases that came to me that said, I can't take hormones because I had a blood clot being on the pill at 50 years old. I'll go, you can still take hormones. Um, there's a lot that I don't love about the oral estrogens. I try to stay away from them for the most part. There's a few people that have come to me and I've been able to transition them off of that, and they do beautifully, and there's a lot less risk. The patch is transdermal, so it's going through the skin. So you're not dealing with first pass liver, so you're not getting all of those inflammatory hormones. And it is a 17 beta estradiol, so it's plant based. It's considered bioidentical. What I like about it is, yes, it's more natural and it's transdermal. I'm happy with that. What I don't love about it is it only comes in certain strengths. It has adhesive. There's, a number of things that don't make it ideal. And some women absorb it great, some women don't absorb it at all. I prefer in my practice to start with compounded topicals because I can tailor make them to that individual woman. So whether it's, creams and sublingual drops or all topicals, however we do it, that's my preference because I really feel like each woman is so completely different than the next. But it's not to say I don't use patches. I use patches in a ton of my patients because some of them, they're solid. That's what they want. It's easier for them. Fine. Covered on insurance or not, but they like it. So there's I think there's something for everybody, but that's kind of that's my take.
Yeah. Okay. Let's talk about some of the myths
Yeah,
and the associated risks. I know you did just mention a couple: higher risk of blood clot, but that is with a specific type of
correct.
hormone. So let's talk about some of the myths, the fears that women have around taking hormones at this point in time in life.
Yeah. When you take transdermal estrogen, whether it's a patch, a cream, a spray, a gel, or the subdermal pellets, you do not have an increased risk of blood clotting. And that has been demonstrated over and over and over again. The other thing, which I failed to mention, is that when you take an oral estrogen, you see an increase in estrone, which is an estrogen that we all have, but when I went to the International Menopause Society big conference a couple years back, they showed the breakdown, the chemical breakdown of estrogen. I mean, down to the tiny little molecular structures. And they really showed across the board that estrone was the more carcinogenic, where estradiol is not. Estradiol is healing and good. Estrone, not so good. So if you're taking a pill that makes your estrone go up, my feeling is, yeah, you're increasing your inflammation, which is bad for you, but you're also potentially increasing your cancer risk, which estrogen doesn't do that. It's the form that you're giving it that can cause more issues. And the topical,
Yes.
the transdermal, you don't see an increased risk of estrone elevation.
Incredible. Incredible. Um, so estrogen. So you had mentioned that in perimenopause, we often see an estrogen dominant state.
Correct. Yes.
So, progesterone is the first hormone to start to decline typically.
Yep.
And so, women who are, maybe a little bit confused at this stage, when they are going to see any practitioner, should they be specifically that, like, hey, let's test where my progesterone is at? And what kind of testing do you prefer?
I used to use a little bit of everything saliva, I used to use urine and so forth. I have found that because we've gotten really much better with our serum, our blood testing, now they've finally come up with ultra sensitive testing. It's easier for patients, it's covered on insurance, and I'm very good at interpreting it. So I use mostly that. Very important though that it's done the proper time of the month because a lot of patients are told, oh, do it during your period. Well, your estradiol and your progesterone are going to be very low at that time of the month. What I'm looking for is post ovulation. How's your progesterone? Because you don't make progesterone until you ovulate from this little guy called the corpus luteum after the egg pops out. So you're going to see the deficiency in progesterone usually like around day 21 ish. And that's why women tend to feel the worst in perimenopause the second half of their cycle. They'll go, God, why can't I feel as good as I feel that week right after my period? I'm like, oh, it's because your estrogen's low. You're a little more balanced. So I do test blood typically. I love progesterone in perimenopausal women, whether it be baby dose topical, depends on the woman. I use sublingual drops so that we can, manage it this much during the early part of the cycle and this much later in the cycle. Use capsules, kind of depends on the person. Progesterone for the average woman is great. And testosterone is a game changer for most women at that stage too, because they could use a lot of help with the sex drive and the energy and the brain and all that. So yeah,
Let's talk about testosterone.
yes,
Honestly, I mean, I am not on it right now, but I definitely know I've done enough research and I'm in this world enough that when I am at that stage, I cannot wait to go there. But let's talk about the importance of testosterone because I think that's also very overlooked in most women. They think it's a man's hormone.
yes, yeah,
Let's talk
all
a
the
little bit about
time.
it.
I have had patients say to me after I put them on testosterone that their doctor said, "Is she trying to turn you into a man? Are you trying to transition? What is she doing?" And women have testosterone just like men have estrogen. So testosterone, great for bone density, great for joint and skin and all of that. Yes, great for libido, but also in myself, I've noticed you talked earlier about confidence, that feeling of like, I feel good. I can get out in the world. It gives me more brain clarity, as it does most of my patients, as well as kind of that feeling of, I can just handle things. I had a woman, it was my favorite story. I had put her on testosterone. She was widowed. She was in her 60s, kind of meek and mild, but very nice. She came back to me after testosterone. She goes, now I understand what assertive means. I feel so good in my skin. And it changed her life. She is no joke, a different person. I've known her many, many, many years now. And I've watched this woman travel the world, have different, relationships, and just conquer life. Seriously, I think it changed her life so drastically.
I just love that. And if you really think about it, all of the things we think when, men are confident and they walk into work and they ask for that raise and they'll take on a project they've never done before and they'll fake it until they make it. And what like here we are. There's a perfect example of a woman who like took on that energy and was like, "Hell yes, this is what we needed."
Yes. I feel myself personally when I don't have enough testosterone, it's hard for me to juggle life and, be clear and sharp and also just that get up in the morning and go, yeah, I'm ready for the day. It changes that so drastically. And yes, I've got women who go, I'm single, so I don't really need a sex drive. And I'll go, you know what, but who doesn't want to walk around the world just feeling sexy and sexual? You never know when you might have that relationship, right? So just having that feeling of sensuality and confidence to me is huge.
Also, why wouldn't you want that well
Right?
into like well into your 60s and 70s? Like that to me, Why wouldn't you wanna feel 25 or 30, like,
Yes,
well into your life? Like, why are we giving up because we're at a certain
exactly.
age?
I have my most sexually active couple, at least that they tell me about, is in their mid 70s. And they've been my patients forever. And they tell me all about it all the time, trust me. But it's so cute. And she has a lot of testosterone and she loves it and she won't give it up. And her doctors have said, oh, you shouldn't be on. And she's not on a huge dose, but I run her slightly above average. She feels fantastic. And she's in her 70s and still having a great sex life. So, you know, there's that.
My husband's gonna listen to this episode, and he's gonna be like, "Michelle, maybe it's time for a visit to the doctor about testosterone." That's so amazing. And so is testosterone, topical?
Typically topical. I like it topical. Now, you can do it in an injection, very, very low dose. You can also do it in the subdermal pellets, but you have to go to somebody who knows what they're doing. And there's so much controversy about that on the internet. And that's rightfully so, because you've had a lot of these, I call them doc in a box places that have popped up that don't know hormones and they're just shoving testosterone in women and causing them issues. So it gave testosterone a bad rap as well as pellets. But yeah, topical is a great place to start for women. Really easy to control, non-invasive. You could put a little in the girly areas, and that helps a lot. So, you know, things like that. Yeah,
Incredible.
great hormone.
Incredible.
My favorite hormone.
Now
Yeah.
yeah, I know, I'm really excited about that. So, let's talk a little bit about the protective properties of hormones and how it's, like, really not a coincidence that women who are menopausal, so women who are still cycling. So you're, 15 to let's say 43, for a very average age range. How are they protected when they have balanced estrogen, progesterone, testosterone versus this natural transition of life
Right.
come perimenopause? And it is no coincidence that things like heart disease and cancer and, all other chronic disease actually go up when menopause starts to begin. Talk to us about the protective aspects.
You brought up a really good point because people think taking estrogen equals cancer. But again, you look at when does cancer risk drastically elevate? It's around age 50 in women. Lo and behold, that's when your hormones drop off. So, yes, there's been studies that show actually, the Women's Health Initiative study, the estrogen alone piece showed a 23% drop in breast cancer in women who started in the first decade. Nobody talks about that. Where I'm shouting it from the rooftops, but the doctors are still out there saying estrogen's bad. It's going to give you breast cancer. So, no, it can be protective. And clearly it was when we were younger. Heart disease, it increases arterial elasticity. So it makes your arteries a little bit more elastic and less ability to form plaque. There's been a lot of research that women who start hormones in that first 10 years have a significant drop, about a 43 to 50% drop in heart attacks and heart disease, which is incredibly important.
Yes.
Decrease in dementia and neuromuscular disease. Neuromuscular diseases like Parkinson's and MS and things like that. Sometimes I have seen a Parkinson's patient who came in barely able to walk, got her on estrogen, and she no longer uses a cane. So just estrogen, it's pretty crazy. There's, bone density. That's one thing we do at least admit, that estrogen makes your bones more elastic, just like it makes your skin softer and more elastic, makes your bones more elastic. So you fall down and they're a little more rubbery and they don't just snap like, little brittle bones. So, I mean, it's so important for that. And again, all of this happens when the hormones go away. So
Yes.
that's what it drives me insane to go, okay, so if estrogen was so bad, wouldn't all of the 19, 20-year-old girls be dropping dead of cancer, and not when we lose our estrogen? So,
Exactly, exactly. Also, I just want to make the point, and you can jump in at any point on this part of the discussion, but like you spoke about estrone, a one type of estrogen that we have as women, it's more inflammatory. So if we are actually taking a synthetic hormone which drives our estrone, that's where we might see those protective measures drop off, or that's where we start to see the increased risk of cancer. And then to another point, there are certain pathways that our estrogen get detoxified out of our body, and some are more inflammatory and damaging than others.
Yes.
And so if you have a genetic predisposition, or you're not testing which pathways these are going down, that can also cause some of the issues. So part of this is nuanced, that like, no, it's not, we're not going to increase cancer risk by taking estrogen, but there are points that some people may require more testing. Everything is bio individual, is what I'm trying to say.
100%. And I know one of the things that you talk about is, and which is incredibly important, is detoxifying your body. So if you're the person who has, 20 extra pounds of belly fat and drinks too much alcohol and has, a lot of stress and a lot of inflammation in their diet, that does affect the pathways, the way you clear your hormones. And it's interesting because, with the craze of all of the GLP drugs and women losing weight and getting rid of all this fat, I'm watching hormones shift like crazy because body fat stores hormones, and not typically good hormones. It tends to create more estrogen. And one thing women don't realize is that your body knows you need hormones. There's a reason we gain weight when we go into menopause. The body goes, well, the ovaries aren't going to work anymore. I'm going to give you this lovely fat in your central area because at least it'll give me some estrone, which is better than nothing. Well, now you've got this more toxic estrogen. You don't have your good estrogen and you don't feel good about yourself. Estradiol will help you to balance out so that you can, doing the right things, get rid of that central fat.
Exactly. And you know what? Let's talk about the weight loss piece, or the weight gain piece in menopause and perimenopause. So it is a protective measure. I mean, nothing our body does isn't protective at some point and for some
Exactly.
reason.
Yeah, exactly.
So we have this protective measure, and women tend to go, I just need to eat less and I need to move more. But really, I mean, and this is my whole, this is my practice. Really, you don't need to eat less and move more. What you need to do is you need to be able to properly. You need to have balanced hormones. Of course, you need to eat well because that's just good for overall health. But you would feel more motivated to eat well and to get those steps in and to get out in the sun and get to the gym if your hormones were balanced.
Yes. Well, and I always tell women, listen, because we're always shamed as women, oh my God, you put on weight, you're probably eating too much. And I have women who come in and they're in tears and they'll go, I'm doing everything right. And they show me exactly, I eat this. They're very specific. They're counting their macros. They're doing everything they can. I work out 6 days a week. And I'll go, yeah. And if your body was functioning properly, that would work. But it's not. So we need to help your body help you because, you're just beating your head against the wall at that point. And I feel bad for women because how depressing is that? And then a lot of women just say, I give up. I'm not doing this anymore because it doesn't work. And then they're miserable and unhealthy and, you know,
Yeah. And, again, no coincidence that it worked when you were 20, when your
exactly.
hormones were at their best and most optimal.
That's so important, I think, to look at is, to me, it's such a no brainer and it makes me insane when people go, "Oh, hormones are bad." And I'll go, no, hormones aren't bad. If they were bad, you would have been fat and had cancer and had heart attacks and everything else when you were 25, 30 years old. So no, it's not that they're bad.
Yeah. Yeah. I, when women are on hormone replacement, and we're talking about bioidentical, I just want to make that clear.
Yeah.
If you also do the other pieces, if you do the detoxification work, if you eat well, if you move your body on top of it, you actually see even better results with the hormone replacement.
Yes. I always say one does not exist without the other, truthfully. Do I have patients who I put them on hormones and they start dropping weight? Yes. That's not the most common thing. Usually it takes both. I mean, look, I am in menopause. I've been in menopause for 8 years probably. And I have to exercise and I have to eat well. Do I eat poorly occasionally? Yeah, on a Friday night once in a while, sure. But the reality is that for the most part, it does take effort on your part, but it's about feeling good. It's not just about, oh, I want to be skinny or this or that. I want to feel good. I want to be functional as long as I possibly can. So I want to keep, muscle mass and keep the inflammation down and keep my brain healthy. And that takes hormones and lifestyle.
Absolutely. And you know what? I'm going to say it doesn't, you don't even have to be in perimenopause or postmenopause for this to affect you. When
True.
I was in my early 30s, I owned a gym for 10 years. So I was like working out like crazy, eating as clean as possible. I was so cut. And all of a sudden, I put on about 25 pounds, like in 2 or 3 months, and it would not budge. And for me, that was like the thing that, you know, it really held a mirror to me like, "Oh, something is wrong."
Yes.
And when I finally got to the root of it and somebody finally tested my hormones, I was postmenopausal hormones in early 30s,
Wow. Wow. And women are told all the time that can't happen. That can't happen. Right.
right? And this is before I had kids. And so I was like, "Oh my goodness, like there's so much down the line here. Like this is a big snowball effect." Anyway, it took me about 3 months to get myself back in order, and I think within 4 months I was pregnant with my son.
Good for you. That's awesome.
So
But
you can
that was
turn it
you.
around, and I lost all the weight.
Yes. But that was you taking charge and finding the right people too, correct? So,
100%.
because I mean, I don't know what your experience was at that time. If you were told by people like, oh no, you're too young, or if you were lucky enough that you had really good providers.
Well, I had to seek them out. I had to really do a lot of investigating, and I had to really be an advocate for myself, and I also had to put budget aside.
Yeah. Yeah.
Like my doctor, I'm in Canada. I don't know if you know that already, but so my doctor is covered under our universal healthcare, which is amazing. And my doctor, the only thing she had to say to me was, "Well, you look good with a little meat on your bones." And I was like, Hold on a second.
My gosh. Thanks.
Thanks, but I feel like garbage. So
Right.
can we do something?" But no, she didn't have any answers for me. And I had to go. I ended up finding a provider in Australia and then later a provider in the US. And then I was like, I'm going to be my own provider.
Good. It's interesting because it's that journey that a lot of women go through that brings them to being more educated than a lot of the providers that are out there, unfortunately. So, you know, I see that a lot. And I asked a doctor friend of mine he's a big guy at Harvard and a very well known hormone menopause expert. And I said, what's going to make this change? And he said, women. He said, women have to finally speak up and say, I've had enough of this. He said, because the system won't change. And that means we're not changing the way we educate providers. So we've got to start with women making a lot of noise because what drives everything? Money. So the minute we say, oh, there's a market for this, then things will change, which is sad. But I think women are finally speaking up, thank God.
Yeah, they need to. So, what would you say if somebody was definitely perimenopausal, potentially postmenopause, but doesn't know because they've been on birth control for, 16 years or whatever it is, and they are terrified to come off because pre birth control, their periods were terrible? Like, what would you suggest to somebody?
What I do with a lot of women like that who aren't feeling good is I will start them because they're afraid to get off their pill. I will put them on some natural progesterone and some natural testosterone while they're on their pill, get them feeling better, and then they're a little more comfortable typically with giving up the pill. But we also obviously then we look at lifestyle and detoxification because if you're doing things that are affecting your liver and you're taking this birth control pill which clears drastically through the liver, you're going to feel horrible. I usually do try to give them all of the education of there's better things out there. Let me gently transition you to the point where we're ready to just pull the pill out. The hard thing is because you're shutting down the entire reproductive system when you're on the pill and you're just giving it these synthetic hormones, it's really hard it's hard to tell where somebody's at until you take those hormones away. But I understand their fear, and I don't want to crash somebody out, especially some of my patients who really suffer with depression and anxiety. So I will typically do it very gently with diet, some progesterone, some testosterone, and that does seem to work and help them.
Yeah. Do you continuously test, or are you going with your patient's symptoms?
A little bit of both. I will, if I'm kind of confused, because too much estrogen and too little estrogen can look very similar. So you can have somebody with weight gain and too much estrogen and hot flashes and brain fog and low libido. You know what I mean? So it's hard to tell in some women, headaches, all of those things. So and those women, especially when they're in that really hardcore fluctuation period, I may test a little bit more often. But yeah, I also definitely go. And I tell women that I'll go, sometimes I look at their hormone levels and I'll go, your hormones don't look like I'd like them to, but they feel so good. I'm like, we do not mess with that. And then vice versa. Sometimes they'll say, my hormones look great and I feel horrible. And I'll go, okay, now let's look at you as an individual. The hormone levels are just kind of a guide for me to give me some insight to what's going on in here.
Yeah. I love it. That's like principle for me is you're not treating the paper. You're addressing how the client or the patient is feeling.
Exactly. Exactly. And that's huge because everybody feels differently. For example, I can have a patient with an estradiol level of 50, which is just a good low mid range level, and she feels horrible and she needs more. Or a different woman may say, oh my gosh, that feels like too much. And again, it's about the balance between the progesterone and the estradiol, and then what is normal, quote unquote, for that particular individual, too. So, like, yeah, blood tests are a guide, but they're not the be all end all.
Yeah, I love that. Is there anything else you want the listeners to know about when it comes to HRT?
I think the main thing that I really want to drive home is it's not dangerous. So let me go back. When I first started doing hormone replacement, and I treat men and women, primarily women, but we were thought that, I'm sorry, testosterone caused prostate cancer, right? Well, that was negated. Of course, we looked at that in men way before we looked at any of this stuff in women. So we went from prostate cancer can be caused by testosterone to no, it can't. To we now have doctors who are more cutting edge who, the minute a guy's clear from his prostate cancer, they put him back on testosterone because they know how important that is for these guys. In the old days, we used to put them on blockers and turn them into basically eunuchs because they thought that stripping all their hormones away was going to be what we needed. Well, women, we're still doing that to women. So,
Yeah.
what I'd like to say is hormones are incredibly important, and estrogen does not cause cancer. If you have an existing estrogen positive breast cancer, can it accelerate the growth of that? Potentially, yes. But we've also found that women on hormones have a 40% decreased mortality when they do get breast cancer. So there's less dying of breast cancer if you are on hormones than if you're not. So, and there's not really a good understanding as to why that is, but my point is it's safe. It changes the way women feel. It gives them quality of life and it gives them quantity of good, healthy life too. So nobody needs to suffer. If you don't get a badge for, going through menopause naturally. You know what I'm saying? I just think that's my big take home is it's just something that every woman deserves.
Yeah, absolutely. Absolutely. Every woman that I come across has literally complained about everything we've talked about in this episode. The exhaustion, the inflammation, the weight gain, the lack of confidence, the anxiety, the depression. And they are just told that this is natural and normal and this is just the way it is. And it doesn't have to be and it shouldn't be.
Shouldn't be. I feel, without getting too controversial, that it's a form of malpractice to withhold something from women that actually can improve their quality of life, but also their overall health. To me, that's really, listen, if I don't understand something, I'm not going to say that I do. So if you don't understand hormones, say, look, I'm not a specialist in that area. I've never been trained in that, and step back. But please don't fearmonger. That drives me insane when they're scaring women or telling them you shouldn't and you can't and all of that. So That's one of my big pleas to doctors and other providers out there.
Okay, so then I'm gonna end with I could probably ask you a million more questions, but let's say somebody's primary care provider says, "This is not my out of my scope. I'm gonna send you to an endocrinologist." And I mean, you just rolled your eyes. You've told me everything I need to know. But I know lots of women who will go and they're like, "Oh, this is a hormone specialist." And they're being told the same things, that this is normal, this is natural. Do women have to advocate for themselves? Where do they start investigating deeper, maybe outside of the conventional medical system if they need to? When is that point? Because it's really convincing when we are so conditioned to believe that our doctors, our specialists, especially in North America, are the answers.
Right.
So
You
when do they
know,
start?
I really think perimenopause is a great place to begin. And I tell my patients the ones who come in perimenopause transition into menopause beautifully. And their health issues are a lot less than those who waited and suffered and went through all of that. So that's important. And you have to speak up and you have to look for somebody who is an advocate for women and open to hormones. Listen, I'm happy if a doctor is even willing to give somebody a patch and permetrium, like more power to them. Thank you for even doing that. But again, these doctors and providers are not trained. So it's not their fault they don't understand, but then it's up to the patient to say, I respect you and I love everything else. You delivered my babies, you're great, you're wonderful, but I feel like this is not your expertise. And then maybe they have to go to somebody and that is their expertise.
Yeah. It's really important for women to go, okay, even though this expert said this to me, I don't feel great and I need to keep asking questions.
Yes. And listen to your body and your intuition. Again, women, and that's a whole other conversation, but women are frequently told to not listen to themselves in so many different areas. And in their health, they go, oh, okay, this just must be what I have to deal with. And no disrespect to providers out there, including endocrinologists, because I know there's some that are very well versed in hormones and female hormones, but it's not what they're primarily trained to do. So to think that somebody, just because they're an endocrinologist or an OB/GYN knows hormones is incorrect.
Yeah. Yeah. Thank you, Christine, for coming on today. Where can people find you?
I have a practice in Thousand Oaks, California, which is Southern California in the United States. And you could look at my website, which is bioidenticalwellness.com. Has all of our info on there.
Amazing. Thank you so much. This was insightful, and I know it's going to help so many women.
Thank you very much for having me on, Michelle. Great to talk to you.